Hello, everybody. Thank you for joining me today for a review of my poster presentation for Franklin University's DSA program. My poster has to do with antigen typing, which is done in transfusion medicine as part of the patient testing to make sure that the blood matches for the patient's special needs. So a patient may have an antibody to a specific antigen on a donor red blood cell. So donor and patient are matched to ensure that they are compatible. So poster is regarding medicine professionals by the FDA, and we have to follow all the rules and regulations of all of our accrediting agencies in addition to that. So the FDA does not require duplicate testing and antigen typing. However, some hospitals choose to do it as an overabundance of caution. So at my current position, when I joined in October of 2023, I learned that the 11 hospital system that I was becoming a part of, some of the hospitals were testing twice. So in other words, the blood gets tested originally at the blood center and then again at the hospital before it goes to the patient. So I was wondering why, because it's not required to do that, and it does take a lot of extra time, reagent cost, and time for the people to do the testing. So tech time, we call it. So what I decided to do was a poll of all of the hospitals in our system to see who was testing and who wasn't. Retesting, I should say, and who wasn't. So we're not talking about AABB and RH because those you have to retest in the United States. So if your unit of blood that says it's O positive, you have to actually retest a portion of that to make sure that it really is O positive. But what I'm talking about here is antigen typing of non-ABO and D antigens. So all the other antigens that are on red blood cells, which there are hundreds, but the most common ones that we see in the blood bank, there's about 30. So many hospitals do not retest those antigens, but some do. So my poll was to all the 11 hospitals. 7 of the 11 hospitals responded to my poll. And it turns out that 71% of the sites were retesting antigens and 29% were not. And the interesting part of this is also that no one is retesting testing that the blood bank does. So we can also do testing ourselves instead of taking what the blood supplier tells us. We can start from scratch and test for our own patients. When a patient has an antibody, we can test at that moment for that particular antigen. But we weren't retesting those. So we trust ourselves, but we don't seem to trust the blood center is what it kind of boiled down to. And that really was the root cause of why some sites were doing it one way and some sites were doing it another. There was an error that happened back in 2009. One of the sites had mentioned that caused them to, moving forward, do that retesting as a caution patient. And like I mentioned earlier, it is not required to retest those antigens. Fatalities caused by non-ABOD incompatible transfusions are exceedingly rare, according to the FDA. And if the blood center tests one donation today, and then let's say the donor gives again in another 4 months, they can retest that donation and then label that donation as, negative for whatever antigen that they're testing for. So it has to be tested twice by the donor center before it's labeled as negative. So what it boiled down to was we had to basically bring this to our medical directors of each individual hospital, and they had to approve whether or not they're okay with doing away with this extra testing. And most of them did. There were 2 that did not. So there are some hospitals still retesting, but I was able to handle states that not necessary to do so, and would be able to pick up compatibility from the patient and the donor if the antibody was demonstrating. In addition to the site-specific, I should say, there's also a New Jersey blood bank professionals group that meets 4 times a year, and I discussed on one of our calls, and I asked on the call, hey, is anybody retesting antigens that come already labeled as negative from the blood supplier? And nobody on the call was. So that's usually about 30 or so different hospitals in New Jersey that get on those calls, maybe slightly less. It wasn't an official poll, but it was just, hey, what are you guys doing? This poster was first presented at the AABB annual meeting in 2024, which was held in October in Houston. And some of the people I met during that presentation were very much in favor of retesting and the opposite as well. So it is a controversial topic. And, hospitals want to do it the way they want to do it. So, it's certainly everybody's choice. But I was happy that, we could eliminate that retesting at our site. It save us some money on reagent costs and the tech time that's involved with retesting. So that's all I have. If you have any questions, my email address is at the bottom of the poster. You can reach out. Thank you.